Thank you very much. And I also wanted to highlight, while we were on the subject of access to care, that this week is actually National Obesity Care Week. It's a public awareness campaign which is all about breaking down stigma and bias and also advocating for complete and respectful care. So you can speak to Joe Naglowski or Patty Neese or Chris Gallagher, and there's materials outside that give you a little bit more information about some of the activities that are taking place. All right, so final stretch. We have our fourth and final speaker. It's Brian Southwell, who is a senior director of the Science in the Public Sphere program in the Center for Communication Sciences at RTI International, as well as an adjunct professor and Duke RTI scholar with Duke University. Dr. Southwell will be addressing the complex environment that exists when it comes to communicating across audiences, especially when the solutions are multimodal and long-term in nature. So with that, please welcome to the stage.
Great. Well, it's an honor and a pleasure to be here today, and I appreciate you taking time to have this discussion. It's one that needs to be had. And there's a lot that we'll talk about, I think, in the discussion immediately following my remarks and throughout the rest of the day. But in thinking about what it is that I might be able to bring, what I wanted to emphasize here relative to the rest of what we've already heard, because there is a fair amount that will dovetail in really interesting and important ways. What I want to emphasize here, just in the few minutes that I have, is that I do think that despite all of our hand-wringing, despite the fact that there's a lot to bemoan, that there is an opportunity to find some hope. And I want to emphasize that. And for me, the place where we might turn for that hope actually lies in the very humanity of the audiences that we are talking about addressing today. Recognizing those limitations in a lot of ways has led us, those limitations anyway, have led us to a lot of what we might worry about and talk about in terms of the contemporary media landscape. But I actually think that there's reason to, despite all of that, be able to look ahead and to recognize that there's an opportunity to meet people where they are and to engage with people that want to be healthy and connected to others in all kinds of ways. So in the interest of disclosure, Liz already mentioned this briefly, but I do work at the nonprofit Research Institute RTI International, and I have the honor of teaching at Duke and at UNC, and I also host a public radio show on WNCU in North Carolina. But the reason I'm here, I think, today is my work as a communication scholar in terms of thinking about the landscape as it's evolved and how we might engage with it. And in a lot of ways, I'm here also because I've been complicit in the creation of that landscape. And here's an example of what I mean by that. I have an opportunity sometimes to talk with reporters about work that I do. And in this particular instance, about a little over a year ago, I had a conversation with a CNN reporter who was quite interested in a new book that we have out on the topic of misinformation, which, for better or worse, and mostly worse, has been a hot topic, in our political discourse and public discourse, in recent years. And in the context of talking with the reporter here, I realized quickly that ultimately, while ultimately I was not misquoted in the conversation and the discussion was fine and reasonable, there was an emphasis here that we were placing on our understanding of how it is that and what role it is that diet might play that was really misguided. And so in this particular instance, I'll come back to this example, there was a worry and a concern about the extent to which people are being misled by the latest fad diet. But just the mere fact that we're even spending time reporting on diets per se itself in ways that resonates with the rest of the discussion we've had already is part of the problem. And I'll come back to that here in just a moment. Part of what we need to consider is that in gearing up to and getting ready to engage in any strategic communication effort, the audiences that we are going to hope to engage with aren't blank slates. That they have had a lifetime of socialization, both in terms of interpersonally, but also in terms of the mass media landscape. And that socialization has led to conceptualization of how health works. And I think that something that gets lost in the shuffle are the indirect ways, and we tell stories to each other about various anecdotes, about various crises, about various issues, what it is that we're saying about how things operate, and how that has an implication for our collective imagination about where we might go together. So an example here that's actually outside of this discussion somewhat, but I think quite relevant, comes from the alcohol arena, where there's a lot that you might worry about in terms of the promotion of drinking. You might think about public health campaigns. But what about even supposedly well-intentioned efforts to, for example, promote designated driving? In those instances, something that may get lost in the shuffle is our emphasis of, our creation of, and thinking about alcohol use as having acute short-term effects. Might be effects that could be avoided by a night of having a designated driver, but nonetheless there's this short-term focus on how it is that the danger of alcohol actually operates. Similarly, I think that we need to do a better job of understanding collectively how we've come to understand some of the issues and challenges with regards to obesity that we're beginning to talk about here today. So another way of thinking about this is that the existing information environment matters, not just for the more sensational reasons that we might think about, but also for the steady drumbeat as it's happened over time in all of our lifetimes to create a narrative in our mind about how it is that people engage with food, with the environment, and how we've gotten to where we are. So given that, how can we enter in and begin to support better public understanding of these issues and these challenges? Certainly, some of the remarks today are going to take us fairly far down the road in that regard. But as we think about this strategically, what are some recognitions and realizations that we need to have about the type of work that we should be doing? Should it be a matter of just carefully crafting a particular public service announcement, or are there broader considerations, different dimensions of the social media and strategic communication and mass media environments that we might need to think about? Along the way, we might then come to realize that the understanding that is in any one of our minds, and collectively the understanding that we have or that public or publics have themselves, there are lots of factors that go into that. And so as we come to think about where it is that public understanding comes from, I think it's ultimately going to be important for us to recognize that there are really many factors at play and many authors. We might think here in ways that we are tending to focus in our discussion thus far today. In terms of the nature of mass media coverage, perhaps we'll talk a little bit about social network diffusion. But we also need to think about the underlying iterative nature of science itself, which is not infallible, which has varied at times in terms of its quality. We have to think about the translation between the sphere of peer-reviewed science and journalists who are trying in earnest ways to do their work. We have to think also about the human audiences that are engaging with this information, about the memory constraints that they face, about the information processing tendencies that they have. All of that together leads us to where we are. And I think it'd be a unfortunate move if we were to just separate out from this larger constellation any one of these factors to just focus there. Ultimately, as we think about public engagement, we have to think about this as existing in this interstitial space at the intersection of groups. Groups that each themselves are trying, for a variety of reasons, to accomplish particular goals. And what you don't see here is necessarily great maliciousness or great nefarious action on the parts of these groups. Certainly that might be at play, and this is something you worry and think about when it comes to misinformation in particular. But nonetheless, here I think it's okay for us to actually acknowledge that each of these groups is trying to do the best that they can in working with each other to try to reach a collective understanding of these challenges. So ultimately then, this is not going to be a surprise for many people in this room, but I think we need to move beyond simply coming up with the right factual information to present to people. There are two dimensions here that I think don't get nearly enough attention. We've had brief allusion to that already here today, but I want to really emphasize that for our discussion. The first of this is that salience matters. For those of us that are living and breathing the topics that we're talking about here today, this is going to be harder to recognize that for most people, even if this is an aspect of their lives that affects their everyday life, information regarding it is not necessarily on their everyday radar. We saw this. Here's a graph that matters more so in shape than in terms of the specific text on there. This is a graph tracking what happened in the public information environment with regards to the Zika virus outbreak a few years ago. And what you see here is a remarkable rise and fall. It's not quite a lockstep graph, but nonetheless, you can see a general movement together as things ebb and fade. And what the lines represent is news coverage of the issue, social media activity with regards to the issue, and people's own searches on Google. And to me, what's remarkable about this is that there are moments of real public attention. But this is remarkably ephemeral as well, that this goes away, and that we see a moment where this fades. And chances are fairly good that in walking over here this morning, you did not Google on your phone or look for any information about Zika virus, nor was that likely to have been on your Twitter feed. And that matters because I think a lot of what we know and understand in terms of public discourse, in terms of public understanding, requires more of a steady drumbeat than we typically have. And so this is something that I think is important for us to remind ourselves. There's good reason to think that we're going to continue to need to beat the drum here, despite what might seem like a moment's spotlight here or there. Second of all, trust is really crucial, and we've had this theme already raised here a bit. We saw this in a different example, work that I did with collaborators at the Centers for Disease Control and Prevention a few years ago, in which what mattered most in terms of people's adherence to and engagement with information about monitoring of passengers from various West African countries in the United States was trust in the source. This came through quite clearly in various analyses of evaluation of that effort. And I think similarly, that's not something that's easily awarded, and it's also something that is easily frittered away in terms of trust as being a part of the relationship between publics and organizations. So I briefly also want to mention here something that's going to be in the room in any discussion like this, is worry about this landscape we live in which it seems as though there's this great prevalence of misinformation. And that's actually what this article was about. This is what the focus and the framing of this article was about the fact that there are all of these, you can quickly find a million diets that don't seem to be grounded in nutrition research. But I actually think that for me, this is perversely where I actually find some reason for hope, or paradoxically anyway. Because I actually think that we tend to misunderstand why it is that we are so vulnerable to the proliferation of misinformation. And I just want to offer just a couple of quick contentions that I hope aren't really contentions here that you would disagree with. The first is that we actually, as social beings, need connection to other folks. So that's part of the reason why we might be attracted to social media in the first place. It's why we might share information. We also need collectively, I think, hope for the future. That's going to actually characterize more of what we look for, more of what we share with each other than almost anything else. I think that what happens is that we often have situations where people are lacking in one of these, where they're actually lacking connection to a larger society, lacking a sense of identification with larger social groups, and that's what they are clinging to in terms of the proliferation of information on social media, as an example. And I also think that people often are looking for ways to keep them and their families healthy, and that's what they're gravitating to in terms of looking for information that's framed as offering hope. So just an anecdote here. I recently had the opportunity to visit folks in Western Australia to give a keynote. And there's a figure there by the name of Belle Gibson, who in a lot of ways I think is remarkable, both in terms of an ethical lapse and what she did to perpetrate and offer up information about ways to cure cancer that turned out to not be accurate. It also turns out to be problematic because she was offering this information as part of her own story as to how she overcame cancer in her life, when it turns out that in fact she never had cancer to begin with. So she was a fraud in that regard. But she also was a celebrity that many people gravitated to. There was a story there that she was able to tell that got much more traction than a lot of our carefully peer-reviewed messages get. And that is what I think we need to look at, is why it is that Belle Gibson was the star that she was. What was it that people were looking to in her message? And that's, I think, a part of the discussion we can have maybe here just in a moment. Ultimately, though, I also think we're all vulnerable to spreading misinformation at various points in time because we are, I think, biased towards acceptance of information at face value, which I know saying that risks undermining my own talk here today, but I promise you, I'm not lying to you, but I actually do think that people tend to accept information and only later tag it as being false or true. There's a longstanding debate in psychology and a lot of empirical evidence that seems to suggest that's actually what people tend to do. So this is going to be a problem if you are momentarily fatigued or motivated otherwise to not necessarily vet information. So you can see why information might easily proliferate. There also are lots of reasons why we share misinformation and information that don't necessarily have to do with the truth value, but have as much to do with connecting to other people. Information and misinformation is currency for relationships, and I think that's actually part of what explains our contemporary landscape as well. It's also the case that in the United States, we live in a place, and I offer this just as an objective description of our regulatory system, we live in a society in which we tend to regulate information and as it exists in the world in a post hoc way. We don't tend to sanitize or censor from ever getting onto the airwaves information, but rather we respond to it. You think about the work of the Food and Drug Administration, for example, with regards to direct-to-consumer prescription drug advertising. There's response to problematic claim as it exists, rather than necessarily wholesale sanitization of an environment to begin with. So we're going to have to live with the extent of misinformation that we have for some time. Lastly, misinformation, once it's out there and leading to misperceptions, can be corrected, but that corrective work also is difficult. It has to be an instance where you're meeting fire with fire in terms of exposure, in terms of actually carefully and explicitly debunking particular ideas, and that's often not what we're able to do either from a public health perspective. Okay, so I've had an opportunity, actually, April's here today with colleagues at NCI, to briefly point out that I think we actually misunderstand this problem of misinformation that we tend to be bemoaning at the moment. There's a lot of it out there. Not all of it is equally important for us, but I actually think that there are ways to move forward here in ways that we are often overlooking. So we recently had a piece in the American Journal of Preventive Medicine where you could read more about that at a later time. Ultimately, though, I want us to think about, for our discussion, what it is that this realization about our collective humanity might lead us to embrace. What steps might we take going forward here? And I think there are really three steps. The first is actually this recognition of the complex interplay between our own human psychology, between the norms of various institutions that actually are, in many cases, honorable, if misguided sometimes, or dysfunctional. We have to think about our own governance structure and what it tends to allow and what it's going to disallow or not in the future, and think about the landscape that we're going to have to live with and how we might operate within that. And we have to think about how all that comes together in trying to plan any particular communication effort. Second, I think we need to do a better job of actually understanding the information that's out there. Rather than prejudging it, we actually have to understand and monitor what it is that people are exposed to, what it is that's led to our collective mental model of the issue of the day here as we're thinking about this. And lastly, I think we need to do a much better job of, rather than, as has already been raised, shaming people or scolding them for believing X or Y information, doing a better job of meeting people where they are, building trust, and in doing so, recognizing with people our collective and shared interest in the public health and well-being of everybody. I think we need to do a better job of actually pointing out where those shared points of interest are between our organizational interests and various audiences. Okay, so I think I'm the end of the panel here. I want to thank you for your time, and I think we're going to move to a discussion. Yep.